Day, and with me today is Titus. She is Clinical Supervisor of Inpatient Rehab at CHRISTUS St. Vincent's, which is one of our good partners here. This program is actually offered by Villages of Santa Fe and AARP New Mexico, and also through grants from CHRISTUS. So we welcome everybody today. We'll wait just a minute and then get started. Hi from Maryland. Hi, Lynette. Hey, North Carolina. Oh, Joyce is here too. Okay. So we're going to get started today. My name is Ann Church. Again, I'm founder of Villages of Santa Fe. And with me today is Titus, Clinical Supervisor of Inpatient Rehab at CHRISTUS St. Vincent's. This program is offered quarterly by Villages of Santa Fe and AARP New Mexico and sponsored by the CHRISTUS Funds and AARP. You know, in addition to our many weekly exercise programs, we also what we call conversations that matter, discussions about our health, aging, and life. We are recording this, and the recording will be available tomorrow afternoon on our website. And I put that email or that address up in the chat room. It is www.villagesofsantafe.org. If you live in the Santa Fe area, we want to remind you to save the date. We have our annual Falls Free Checkup on Wednesday, September 24th at CHRISTUS Hospital, and hope you can join us. We have risk assessments, info from all different departments, exercise demo, and lots of fun. And I hope you can join us. Katie is the monster behind all of this, putting it all together. And it's all free. Just drop in from 9 to 1 p.m. This workshop focuses on fall prevention because unintentional falls are the leading cause of injury and injury death among older adults over 65 in the U.S. and New Mexico. We get started now, but put in your chat where you're from and also what interests you in fall prevention. So I've put some ideas in the chat, and you can put those in there. One of them is to improve your balance, reduce your risk of falling, how to learn to fall safely, increase your physical strength, recover from an injury, learn home safety tips. But if you have any other questions, we'll be unmuting later on and you can ask questions or you can put them into the chat. So with that, we're going to get started for today. So Conversations That Matter. Villages provides age-appropriate live and online in-person exercise programs focusing on balance, strength, and flexibility. And all of these are critical for fall prevention. This workshop's designed to reduce the fear of falling. We'll talk about that falling is a cycle that you can break. The myths about falling, fall statistics, some of the bad habits that increase your chance of falling, what causes falls. We're going to delve into what your risk of falling is, what to do if you fall, and then we'll have a Q&A after the program. Here today, I'm Ann Church, and also Katie Titus again. Katie is the Clinical Supervisor, Inpatient Rehab at CHRISTUS St. Vincent's. I am a Master Trainer for a Matter of Balanced Fall Prevention Program from the New Mexico Department of Health, and we put these programs on a regular basis. Katie, that's for you.
Hi, everybody. Thanks so much for having me. I'm a physical therapist. I work with a lot of patients who have fallen. I do a lot of fall risk assessments. So I'm really happy to be reaching out to the greater community to try to do my part to educate people on what they can do to decrease their risk of falling. Exercise is one of the most important things you can do to reduce your risk of falling. So there are 4 major overarching types of physical activity: endurance, strength, balance, and flexibility. We'll talk a little bit about all of those and how they reduce your risk for falling.
Sorry.
No worries.
There you
go. Everybody's got an excuse why exercise is hard or inconvenient for them. I'm of them, but we'll talk about some barriers to exercise and what you can do to reduce those barriers. Safety tips, because certainly exercising unsafely could lead to falls, so we want to avoid that at all costs. There are lots of other potential causes of falls that we'll discuss in this presentation, including medication, vision, hearing, and nutrition. And then Anne's going to go over some cool home safety gadgets for better living and fall reduction. So falls really carry a heavy burden on quality of life. So older adults may fear falling, as a result may limit their activity and social engagement. And as you'll see on the next slide, falling is a vicious cycle. When we have a fear of falling, we do less. When we do less, we get weaker, our balance gets worse, our flexibility gets worse. We move less and we actually increase our risk for falling again. So of patients who are hospitalized for a fall-related injury, 35% of them will be readmitted for a fall-related injury, and 5% will die within a month. So falls are a big deal.
And Katie, you see that in your rehab situation where people get readmitted to the hospital after falling.
I do, absolutely. One of our biggest goals is to reduce people's risk of readmission after they leave us, but unfortunately, you know, once your risk factors pile up, and especially if you're not able to follow through with a good exercise and balance program, then your risk of falling again is increased and being readmitted to the hospital is increased. So according to the US CDC, more than 1 out of 4 Americans aged 65 and older falls annually, and they are the leading cause of fatal and non-fatal injuries among older adults.
So we can talk about the myths of falling. You know, a lot of things that we have in our brain, we need to maybe reschedule or recalibrate. So it's not me or I'm just old. Falling happens to other people. Well, statistics tell you otherwise because again, 1 in 4 and actually 1 in 3 in New Mexico over the age of 65 fall. Falling is something normal that happens as you get older. Obviously, the statistics say we do fall, but falls are preventable. And that's why we're adamant about bringing this fall prevention information to you, because there may be things that you are not aware of that could easily cause your falls. Another one is if I limit my activity, I won't fall. And as Katie discussed this vicious cycle, if you don't act, you're not active, then your muscles are going to atrophy. Then you're going to get more at risk for falling. As long as I stay at home, I can avoid falling. Oh, what's the percentage? 70% of falls, Katie, happen at home, something like that. So
Something like that, yeah, and the vast majority in the bathroom.
yeah. So bathrooms are dangerous. Muscle strength and flexibility can't be regained. That is not true. You can regain muscle strength and flexibility, although it will decline over the years. Taking medication and medication doesn't increase my risk of falling. We'll discuss this later, how you really need to, if you're taking multiple medications or even just one, is to make sure you understand the side effects of the medication, the changes in dosage, etc. We also talk about vision and how it affects your balance, and also hearing. Also, assistance devices. Using a walker or a cane makes me more dependent. It doesn't, it makes you more independent. And the more you exercise, the more likely you're going to stay independent. So use your cane or your walker. We're going to talk about communication because when we first started with fall prevention with Maria and I were certified by the Department of Health as matter of balance trainers. They brought up this idea of communication, and we're like, well, what does that have to do with fall prevention? But we'll see why it's very important because, as we say, preventing falls is a team activity, and that involves your healthcare provider, your family, and everybody around you as well. So according to the CDC, more than 1 out of 4 Americans aged 65 and over fall annually. Falls are the leading cause of fatal and non-fatal injuries, and exercise is the only way to prevent falls.
So again, falls are preventable, and they're the most common cause of older adult traumatic brain injuries, accounting for over 46% of fatal falls among older adults. We'll talk about brain injuries a little bit later. So specifically in New Mexico, this is a graph depicting the adult fall rate deaths per year in New Mexico and the US. And New Mexico has a significantly higher rate than the national average. Partly our older adult population is much larger than the national average, so I assume that's partly why that is.
Yeah, I think so. I mean, we have to look at like the national average for those over 65 is about 17%. And our counties rank anywhere from 22 to 29%, also being in a very rural area. And I think when we talk about traumatic brain injury later on, you can talk about the issue of getting medical assistance and medical care if you
Absolutely.
do fall and hit your head.
Yeah. All right, so when we talk about balance, you've got three major contributing factors to your ability to sense your balance. So this isn't how to correct your balance, this is how to feel your balance. So vision is the one that we rely on the most as adults. So as we age, if our vision becomes more impaired and we're not correcting it, we're getting rid of our number one sensory system that helps us detect if we're losing our balance. Proprioception is our awareness of our joint position. So whether we are walking uphill or downhill, especially if we're leaning too far forward or backward. And the vestibular system is a connection between your inner ear and your brain that senses rotational forces and acceleration and deceleration. So some questions you might ask yourself to determine whether or not any of these systems are impaired is, do I feel unsteady? Do I feel as if the room is spinning? Do I feel like I might lose my balance and fall, or that I'm actively falling? That's a big problem, right? Do I feel lightheaded, as though I might faint? Or is my vision blurred or maybe not very accurate? So the Center for Disease Control has created this set of assessments to assess your risk for falling. STEADY stands for Stopping Elder Adults Death, oh my goodness gracious, Stopping Elderly Accidents, Deaths, and Injuries. Whew, tongue twister. So there are four major assessments that we look at to determine someone's risk for falling from a physical perspective. So the first one is postural, aka orthostatic hypotension. So the question, do I ever feel like I might faint? This could be one of the reasons why you're feeling faint. So this is an abnormal drop in blood pressure between being horizontal and being vertical, so lying down and standing. So the way it's measured is we have someone lie down for 5 minutes, we check their blood pressure, and then we have them stand up, and after a minute we check their blood pressure again, and then check it again after 3 minutes.
And Katie, this is part of what we're going to be doing at our Falls Free Checkup.
It is indeed.
Do
Yeah.
all four of these at our Falls Free Checkup. So it's really good for you to come and have these risk assessments for your knowledge.
Yeah, absolutely. A positive test for orthostatic hypotension is a 20-point drop in your top number, your systolic number, and or a 10-point drop in your bottom number between lying and standing. The next test is the 4-stage balance test. So we look at your ability to maintain your balance for 10 seconds in 4 different positions that are progressively more challenging. If you're not able to do the first 3, you're considered to be at an increased risk for falling. And the next one is the timed up and go. So this measures your ability to stand up from a chair, walk 10 feet, turn around, come back and sit down in the chair. And we record the amount of time it takes and we compare it to the goal of 12 seconds. So if you are significantly above that, your fall risk is significantly higher. The closer you are to 12 seconds to stand up, walk 10 feet, turn around and come back, the less likely you are to fall. And the last one is the 30-second chair stand test, and we're going to get some audience participation on this one. So take a look real quick at your age-related norm and gender matched norm in the bottom right corner here. So women 60 to 64, the goal is to have 12. And 12 or more, excuse me, 65 to 69 women, at least 11. So what we're going to do is count how many times you can stand up and sit down in 30 seconds without using your arms. So
So
let's
Katie, you
get
want
it.
to do a demo of that?
Yeah, absolutely. I'm gonna back up a little bit.
Okay, so let me explain. So Katie's going to do a demo. And then we're actually, everybody who wants to participate, we'd love to have you participate. Now, we do want you to make sure that you're in a safe place. Your best place is in a chair without wheels. So you can sit and stand. So as you watch Katie do this, why don't you why don't you figure out if you would like to participate with this?
So it's continual sitting and standing as many times as you can in 30 seconds. You can take a break if you need to at any point.
All right, so I am going to, if anybody who wants to participate, I'm going to start the timer. And after 30 seconds, I'll say stop. And then what you'll do is record your number. Then we're going to look at your scoring over here. And I want you to keep track of that because as we progress, let's say you're going to start an exercise program this next week, or you're going to come join Villages and exercise. We want you to then look at every 30 days to see if you're improving with your sit to stand. So I'm going to count down and then we're going to start. 3, 2, 1, start. And stop. So what you would need to do here is record your number. And then these tests and this information is going to be available on our website tomorrow. You can download these tests and assessments and keep them in your file. So one of the things we like to do is, like when we do our risk assessments, take that to your doctor and discuss your issue of risk assessment. So we've done that. Great. Katie, are you there? I think Katie has gone offline for some reason. Huh, all right, it's okay. Hold on just a minute. Okay. All right, so what if you've fallen? Your doctor's going to want to, when you go for your annual checkup, your doctor is going to ask you if you've fallen in the last 12 months. Were you injured? Are you afraid that it'll happen again? And have this discussion with your healthcare provider. And one of the problems we have with falling is then a fear of falling. So let me mute somebody just a second. There we go. How to become a safer faller. So you say, okay, 1 in 4, 1 in 3 people in New Mexico fall, 1 in 4 nationally fall. If you're not exercising regularly, it's unlikely that you could change the mechanics of how you fall while you're falling. But there are things that individuals with higher levels of fitness and body-brain connection can do to minimize injury during a fall. Stay loose and bent. Don't freeze up. Tuck your head and look away from where you're falling. So land on what we call the meat, distribute the force. Keep falling. Don't try to prevent the fall. The better thing is to fall and try to roll and keep your head protected. If you break a wrist, that's really bad. But if you hit your head and get a traumatic brain injury, that's significantly worse. So we've talked about traumatic brain injury. We hear from falls. Aunt Martha fell, she broke her hip. But traumatic brain injury is really the more critical issue of falling. And it is usually the result of a violent blow or jolt to the body or head. Always see your doctor if you received a blow to the head or body that causes behavioral changes. and seek emergency medical care if there are any signs or symptoms of a traumatic brain injury following a recent blow or other traumatic injury to the head. So what happens when you get a TBI? You can have a direct impact. Let's say you fall and you hit your head, you fall forward and you hit your head on the front. But what happens is you can see in this second group right here that you're going to have acceleration and deceleration brain injury. So front and back, your brain is literally, sloshing around in your skull. And that's what can cause a tremendous amount of damage to your brain. So what are the symptoms? Headache or feeling pressure, a loss of consciousness, confusion or feeling like you're in a fog, amnesia if you don't remember, dizziness, seeing stars, ringing in the ears, nausea, vomiting, definitely, slurred speech, delayed response to questions, appear dazed or fatigued. I mean, the problem with TBI is that it's not evident that something has happened inside your brain. You've heard the stories of the skier with the helmet, hits a tree, says they're fine, and they're dead. I mean, a TBI is very dangerous, and you also cannot detect it yourself. You must go to the hospital, especially number one, if you've lost consciousness or you have slurred speech or nausea, vomiting. Please go to the hospital. So we have a lot of bad habits that can increase our chance of falling. So as we go along in our daily lives, we develop risky behaviors that increase our chances of falls. There's some simple steps to identify and correct the problem. Personal behavior patterns that might place you at risk. You can think about the behaviors that place you at a greater risk of fall and implement some simple solutions to avoid potentially dangerous situations. So some of those things can be as simple as wearing flip-flops. It can be, we're going to talk about cleaning up the clutter in your home, taking up the rugs, lighting areas, keeping things safe where they should be, where you're using them. All of those things are very important to keep you safe. But the main thing, the only way to prevent falls on the long run is the importance of exercise. So exercise is, according to the CDC, the only way to truly prevent falls. So what are your barriers? We can identify which exercises are best suited for the fall prevention, and then create a daily exercise routine. Safety tips. Be sure to be safe. Don't hold your breath during exercise. Use safety equipment. If you're biking, wear a helmet. Drink plenty of fluids during physical activity. Dehydration can cause dizziness and lead to a fall. We live in the high mountain desert area. We drink a lot of water. This is my daily water bottle right here that I keep with me, and I refill it a couple of times a day. Warm your muscles before you exercise. Ways to be active. Endurance. So endurance is building up a level of activity to about 30 minutes of activity that makes you breathe hard on most days of the week. The CDC recommends 150 minutes of exercise weekly. Katie says her technology is behaving for what? She's
I'm
restarted.
back. I'm back.
There she
I'm so
is.
sorry. I had to restart my whole computer, but I'm back.
That's okay.
Apologies.
So we're talking about endurance. That can be walking, dancing, biking. The interesting thing is I have some hip issues. I'll probably have a hip replacement surgery this fall. And I found that rowing is super good for me. I can do it indoors, so it doesn't matter what the weather is. Rowing actually affects like 80-something% of the muscles in your body and gets you a good cardio, and it does not seem to bother my hip whatsoever. So find the exercise that works for you and incorporate that into a regular routine. Strength builds strength exercise. They build muscles. You can regain your muscles, your muscle. And even though as we age, we lose muscle, it can be regained by exercising and finding the right exercises for you that are age appropriate. We don't need to be doing burpees or adding more weights. We need to keep the cardio up and the strength. Flexibility is super important. And stretching can improve your flexibility. Join a gentle yoga or a stretch class and make it a habit. Your body will thank you for it. Balance, simple exercises to improve your balance. Very interesting. When you start to work on your balance, it's if you dedicate 20 minutes a day, you're going to see an improvement in less than 2 weeks. I mean, it's very, very evident that you've gotten better at it. So it's not one of these, maybe in 3 months or 6 months or a year, I'll be better. You can improve your balance literally in 14 days. We talk about mindset. We've talked about assertive communication. And this is where, as we age, we've got to have a good attitude, a belief, a demeanor, a frame of mind that helps us cope with the things that we're going through, but also then keeps us healthy mentally and keeps us from being socially isolated. And how does this relate to fall prevention? So we talk about assertive communication and the value of good communication with your family. When you have to have, it's just a core communication skill. It's not aggressiveness. It's just expressing your needs and your wants. So fall prevention a lot is maintaining your ability to live independently. And if you want to live independently, then you need to be able to share issues with your doctor and provider and your family so that they can understand what your goals are. And if your goals are to stay at home, then you say, I am going to exercise. Please keep after me. Maybe you need somebody that just keeps reminding you on a text, did you do your exercise today? But whatever it is, work on your communication skills. When you go to the doctor, have your list of communication and questions and ask them questions. Katie's going to talk about other risk factors now.
Again, apologies for my immediate departure there when my computer just went away. Okay, so we know that medications play a big role in people's risk for falling, and especially the overuse of medication or medication that have drug interactions that are negative. And 81% of older adults use at least one prescription drug. 49% of older adults use at least one dietary supplement. 29% of older adults use at least 5 prescription medications concurrently with non-prescription drugs. So there's a lot of potential for drug interactions. Some of the drugs that we're especially concerned about are diuretics. Again, we know that the vast majority of falls occur in the bathroom within the home. People who have to rush to get to the bathroom because they're going to the bathroom a lot are at a higher risk for falling. Diuretics can also drop your blood pressure. So can other blood pressure medications. So when we were talking earlier about orthostatic or postural hypotension, that change in blood pressure from lying down to standing up, when we see a drastic drop in blood pressure, you're at risk for fainting. So if you're taking one medication or more, you're going to want to talk to your doctor about whether or not those medications put you at an increased risk for falling. You might have your doctor take a look and see if you could be getting by with lower doses of medications or if they're concerned about any of the interactions between the drugs you're on. And that includes supplements. So please also make sure you bring in a list of the supplements you're on when you have your doctor or your pharmacist review your medications with you. So next we'll talk about the importance of an annual eye exam. So again, we know that vision is the most important system in terms of what we tend to rely on to notice whether or not we are balanced. So it's really important after the age of 65 to get an annual eye exam. If you are already wearing glasses and you're under the age of 65, you should still be getting an annual eye exam. I have a ton of patients who have bifocals and trifocals or progressive lenses. Those also can carry a little bit of an increased risk for falling on uneven ground, especially because your depth perception becomes impaired. So when you get your eye exam, bring these things up to your eye doctor. I've noticed that walking on uneven ground makes me feel a little more unstable. Is there something that you could do to tweak my prescription to make me feel better? There's also more evidence coming out about the importance of getting a hearing exam. We know that there's a clear connection between hearing and dementia. We also know there's a clear connection between dementia and falls risk. So we think that getting a regular hearing exam and making sure that you have appropriate hearing aids if you need them can also make a big difference in terms of your ability to sense your surroundings. There may be connections to your vestibular system as well if you have impaired hearing. So it's also important to get an audiology exam if your hearing is impaired. So in terms of footwear, this is a hot topic. The biggest goal is that when you're walking, you're wearing well-fitting, supportive, low-heeled, non-slip shoes. A lot of people love wearing sandals. I'm one of them. If you're going to wear sandals, make sure they have a strap on the back. If you have diabetes, it's really important that you're inspecting your feet daily to make sure that you don't have a wound you're not aware of. People with diabetes also have usually peripheral neuropathy, which means that you can't feel your feet as well. So you might not do as well on uneven ground. So it's important to have a good supportive shoe that will help support you if you're walking on gravel or dirt or up or down hills. All right, hydration, super important. So hydration can also be sort of related to like medication related side effects. So dehydration can cause a lot of the same symptoms as a medication side effect, including confusion, dizziness, increased heart rate, lightheadedness. So really important to drink lots of water, at least 8 glasses a day. And make sure that it's throughout the day. It's not like you're drinking right before you go to bed, because then you have to get up in the middle of the night to go to the bathroom. Try to spread it out, mix it up, throw in some tea, throw in some, like a water additive, a flavor. If you don't like drinking plain water, throw in a lemon slice, but make sure that you get lots and lots of water throughout the day.
So when we talk about, everybody thinks about home safety. So it is very important. Clear the clutter. Don't leave like 5 sets of shoes on the living room floor. Pick them up, light it up, hold the rails. Very important. We talk about when you are bringing in your groceries or taking things up the stairs, give yourself time and stability. So time means don't be rushing up and down the stairs, but giving yourself stability means being able to hold on. So instead of bringing in all the bags of groceries at one time, bring in one and have a hand free. Cut the skids, toss the rugs, and move it where you use it. So in the kitchen, if you're constantly reaching way up above to get something, let's move it down to where it's more like eye level or waist level. Again, we will have these checklists on our site, Villages of Santa Fe, tomorrow. Just check for fall prevention. It'll be in the blogs, and you can download this as well as all the steady test risk assessments and some other forms as well. I'm kind of a gadget freak, and my big thing right now is motion activated lighting. So you see there's a picture of that's my garage. So as I walk in, of course the garage door opener has a light, but it's not very bright. So I have a number of different motion detector lights. So one is right by the door, pretty light, and there's also one down there on the step. So I see that step no matter what. I don't worry about missing it. And those little lights, the one on the top, I think it's about $20 for 2 of them from Amazon. The other one down below is about 3 of them for 15, or actually I think I got 6 of them the last time for about 18 bucks. And they're all LED lights. They run off batteries, so you don't have to plug them in, which is just wonderful. I have 3 of these small circular ones going up my stairwell. So if I have to go up the stairs at night or come down the stairs, I don't have to turn on the bright lights. They light as I go down the stairs. The one in the center there is a really cool bed light. It's a strip. It's little tiny LED lights on a strip that you peel off and fasten underneath your bed. And then you have a motion detector that can either be on the floor, so when you step down it lights, or if you're like me and I have dogs, my dog was turning it on all the time. So I put it up by my bedstand so I could just wave my hand and turn the light on. And what that does is when you have to get up in the middle of the night, it gives you a little bit of light. You can set the timer as to how much time you want for it to be on. And it's a really low light, so it's not disturbing your sleep. We talk about using canes and walkers. Around here in Santa Fe, you will really frequently see people using trekking poles and walking around Santa Fe. They have tips for them. You can get rubberized tips so that they won't slip. They also have baskets for snow, and they're relatively inexpensive. And I actually have those in my car and carry them in every place. Fall detection, we always worry about that. Live alone. There are various fall detection services that you can subscribe to. You have to wear them around your neck. It seems like when I talk to people who have one, they say, yeah, my daughter gave it to me. And I say, well, where do you keep it? And it's by my bed in the drawer. They don't put it on that much, so, but I have an Apple Watch. I love my Apple Watch because it keeps me honest as far as my exercise, but it also has an SOS if I fall. So that if I fall, it has I don't know what, a decelerator in it. It will come up with this message that says, look like you've taken a hard fall. And SOS, it'll call emergency, or you can hit I'm okay. If you do not answer this call, it will call 911. It will also call the people that are on your medical alert list. So actually, for some reason, my watch went off last time I was in Portland, and it called all my friends here in Santa Fe, and it called the fire department or 911 in Portland. And unfortunately, I was able to figure out something had happened I don't know what happened with the watch. And I was able to call 911 and say everything is okay. You don't have to, send anybody out. But it's quite a good feeling that I know I have that. You can also, if you need to, you can hold the side of your watch down and initiate this call as well. It does require an iPhone, but if you have one, I think it's a great way to go because there's no extra monthly charge with it. So what to do if you do fall? You're going to stay calm. So much of the time, let's say I was walking down next to the Santa Fe River, which is kind of a little tiny stream here, and there were some tourists trying to walk across the stream on the rocks, and a lady fell. Immediately, they ran over to her. She's down on a rock in the middle of the water, and they're trying to pull her up, and I'm like, whoa, wait. I know this is not the best situation for her being in the water, but let's assess the situation. Because if you try to pick her up, you may hurt her more than she is. Secondly, you could hurt yourself. Let's check for injuries, breaks, brains, blood. Let's just figure out what's wrong. Did you hit your head? If you lose consciousness, if so, call 911. I can't emphasize how many times as being in villages, people have called me and said, my partner is on the floor. Can you come help? And I said, I can call help. The first thing I'm going to do when I get there is I'm going to call 911 if he's not up or she's not up. Because I can't safely lift somebody or even assess them if they can't get up off the floor. The 911, and Katie, you can respond to this, that the emergency people are lovely people. They really want to help.
And it's what they do all day long. And they are really good at making that decision about whether or not you need to go to the hospital. They're not pushy about it, they're objective, and they are there to help you.
I think that one of the things we don't really think about that our fire department is our first responder for falls. And if you can understand and be comfortable with that, I think my next program here, I'm going to invite the officer who's in charge of falls and fire from the county here in Santa Fe to give us a couple of slides and give us their opinion and their comment on how they work with people with falls. So, we're glad you could come. I hope you learned some things from it. We would love for you to join Villages. We have free classes. We have free class on Monday morning, Wednesday afternoon, and Saturday morning in person in Santa Fe. We would love to have you join us, and we have really big classes on Monday. These are sponsored by AARP. We had, I think, over 350 people the Monday after Easter joining us for our exercise class. You can find us at Villages of Santa Fe. We are also sponsored by CHRISTUS Fund, AARP New Mexico, the Las Campanas Community Foundation, and Quorum St. Vincent's. All of this will be recorded, and we will have that recording up tomorrow afternoon. And we will post that, and it'll also have, I'm going to pause. I'm going to stop share. There we go. There we go. And I'm going to pause the recording. So if you would like to ask questions, please unmute yourself. Let me make sure